Itu sudah muncul lah screen-nya.
Yes.
Iya.
Sudah.
Okay.
Dari awal dulu, Del.
Assalamualaikum warahmatullahi wabarakatuh. Let me introduce my group. We are from Group 6. The members are Ahmad Zahrani, and then me, Delvisi Cahya, and Muhammad Ikhlasul Amal. And today we are going to discuss about COVID-19 topic. And let's get started. Do you think COVID-19 is real? In my opinion, COVID-19 is real because, as you can see, that many victims who have been infected with this virus. According to the WHO, the total case of COVID-19 in the worldwide has reached more than 50 million victims, and in Indonesia has reached more than 300,000, and this number will be increased every day. This virus is very easily spread through saliva and physical touch, and whoever can be infected with this virus. But the elderly and people who have the weak immunity are more susceptible to be infected with this virus. And as you can see, there's an article reporting from covid19.co.id. The spokesman of COVID-19, Dr. Raisa Broto Asmoro, said that the COVID-19 is real. She explained that this virus really exists. And she also explained that how the chronology of the outbreak occurred. Dr. Raisa said that the virus, which was first discovered in December 2019, has many types. This virus is usually found in animals. Several types of coronavirus infect humans, such as SARS in the early 2000s and MERS in 2012. So I think I agree that COVID-19 is real. And the next explanation will be presented by Zahrani.
Okay, I will continue the presentation. My opinion about COVID-19 is real because there is a lot of evidence that support it. You can find every evidence from the casualties to the virus itself. The next, please. In the next slide, you can see that at every news, I'll include some news from BBC and CNN. In the first image you can see it's from 28th June 2020. COVID-19 death toll just 50, it's just 500,000 worldwide, but into 29 September 2020 global COVID-19 death toll passes 1 million, so it's very likely that the virus is real. The presentation will be continued by Ikma.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ikhlasul. Okay, in this group, we all agree that COVID-19 is real. However, if it is said that COVID-19 has a high risk for all groups, then I disagree. Next. Next down. Okay, this is the result. The result of a research team from the Faculty of Medicine, University of Indonesia, and the DKI Jakarta Provincial Health Office show that old age, pneumonia, shortness of breath, and hypertension are risk factors for death in COVID-19 patients. The risk of death increases from the age of 50 years and over, with a significant difference when compared with the age below. In addition, from 41.1% of COVID-19 patients with pneumonia, 81.6% of patients died. The patients also had symptoms such as cough, fever, and shortness of breath. The risk of death of COVID-19 patients in old age increases due to the influence of the decreased body's immune system. Patients with pneumonia and shortness of breath are also more likely to have a bad outcome because the chance of the patients falling into acute respiratory distress syndrome increase. This study also states that hypertension doubles the risk of death for COVID-19 patients. Next. Previously, the pulmonary doctor of Persahabatan Hospital, Andika Chandra Putra, said that the condition of a person's body when exposed to COVID-19 greatly affects the complaints and response of the disease to the body. If the immune system is good enough, so if exposed to COVID-19, the symptoms tend to be mild or even absent. If the immune system is weak or you are elderly or you also have comorbid disease, exposure to COVID-19 will tend to cause more severe symptoms. Okay, on this, on those slides, we can see that it is show that someone who has age 50 and over can get higher risk of COVID-19 if you compare with someone who has age 50 and under. Okay, the conclusion based on existing evidence, facts, opinions, and examples, so it can be concluded that COVID-19 is real. The number of victims and the impact caused by COVID-19 was enormous. This virus is very dangerous, especially for people who have old age and have comorbid diseases. Therefore, to avoid this virus, stay at home, stay healthy, wash your hand, wash your hands regularly, work out, and wear a mask if you have to leave the house. Okay, that's it. Thank you for attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Waalaikumsalam
wabarakatuh.
warahmatullahi wabarakatuh.